Hello and welcome. Today, we're diving into the world of the urinary system to explore a condition known as obstructive uropathy. This occurs when the flow of urine is blocked somewhere in the urinary tract, leading to a buildup of pressure and potential damage to the kidneys. Understanding this condition is crucial for early detection and effective management. So, what causes this obstruction? The list is quite diverse. Kidney stones are a common culprit, blocking the ureters, the tubes that carry urine from the kidneys to the bladder. Other possibilities include an enlarged prostate in men, which can compress the urethra, the tube that carries urine from the bladder out of the body. Tumors, whether in the urinary tract or pressing on it from the outside, can also cause obstruction. Scar tissue from previous surgeries or infections, congenital abnormalities present at birth, and even blood clots can impede urine flow. Now let's talk about what happens when urine flow is blocked. This blockage leads to a backup of urine, increasing pressure within the urinary system. Initially, the kidneys might try to compensate by increasing their filtration rate. However, over time, the sustained pressure can damage the delicate structures of the kidneys, specifically the nephrons, which are responsible for filtering waste. This damage can lead to hydronephrosis, which is the swelling of the kidneys due to the buildup of urine. If left untreated, it can eventually lead to kidney failure. Obstructive uropathy can affect people of all ages, from infants with congenital abnormalities to older adults with prostate issues or tumors. Kidney stones are a significant risk factor across many age groups. The incidence also varies depending on the underlying cause. For example, benign prostatic hyperplasia, or enlarged prostate, is a common condition in older men, making them more susceptible. More exact numbers are hard to give because obstructive uropathy is often diagnosed secondarily to another primary condition. The signs and symptoms of obstructive uropathy can vary depending on the location and severity of the blockage. Some people may experience no symptoms at all, especially if the obstruction develops slowly. However, common signs include flank pain, which is pain in the side or back, changes in urine output, such as decreased urination or increased frequency, difficulty urinating, a weak urine stream, and feeling like the bladder is not completely empty. You might also experience blood in the urine, urinary tract infections, or even high blood pressure. Diagnosing obstructive uropathy typically involves a combination of medical history, physical examination, and diagnostic tests. A doctor will ask about your symptoms and medical history. Imaging tests such as ultrasound, CT scans, or MRI are often used to visualize the urinary tract and identify the location and cause of the blockage. A cystoscopy, which involves inserting a thin tube with a camera into the urethra, may also be used to examine the bladder and urethra directly. Urine tests can check for infection, blood, or other abnormalities. Blood tests can assess kidney function. Obstructive uropathy can be classified by its location, severity, and duration. It can occur in the upper urinary tract, involving the kidneys and ureters, or in the lower urinary tract, involving the bladder and urethra. The obstruction can be partial or complete, and it can be acute, developing suddenly, or chronic, developing gradually over time. Understanding these classifications is important for tailoring treatment strategies. Treatment for obstructive uropathy aims to relieve the obstruction and prevent further kidney damage. The specific treatment approach depends on the underlying cause. For kidney stones, options include medications to help dissolve the stones, shockwave lithotripsy to break them into smaller pieces, or surgical removal. For an enlarged prostate, medications can help shrink the prostate or relax the muscles around the urethra, or surgery may be necessary. Tumors may require surgery, radiation therapy, or chemotherapy. In some cases, a temporary drainage tube, such as a catheter or a nephrostomy tube, may be inserted to drain urine and relieve pressure on the kidneys. Preventing obstructive uropathy often involves addressing the underlying causes. Staying well hydrated can help prevent kidney stones. Maintaining a healthy weight and managing conditions like diabetes and high blood pressure can also reduce the risk of developing kidney stones and other urinary tract problems. For men, regular prostate exams can help detect and manage prostate enlargement early. Prompt treatment of urinary tract infections is also important. The prognosis for obstructive uropathy depends on the severity and duration of the obstruction, as well as the overall health of the individual. Early diagnosis and treatment can often prevent permanent kidney damage. However, if left untreated, obstructive uropathy can lead to chronic kidney disease and ultimately kidney failure. Recent research focuses on developing less invasive techniques for removing kidney stones and treating prostate enlargement. Advances in imaging technology are also improving the accuracy of diagnosis and treatment planning. There's also growing interest in genetic factors that predispose individuals to kidney stone formation, which could lead to more personalized prevention strategies.